You've probably heard similar stories before.
A 28-year-old woman lies paralyzed
People experiencing strokes after cervical manipulations,
for a stiff neck after studying for college exams.
leaving patients with permanent health damage.
She can communicate only by blinking.
Dr. Boisvert, Canadian chiropractor, here to address a very serious subject, the link between neck manipulations and strokes. Now, before I address this issue, I know some of you might be wondering why manipulate the neck or even the spine in the first place, given that we have limited evidence supporting their use. The literature on conservative care management, whether it's physical therapy, chiropractic, osteopathy, acupuncture, massage therapy, or even passive modalities like interferential treatment, also known as TENS, ultrasound, cold laser, etc., is flawed. In other words, fucked from the start. We simply don't have strong evidence that any single technique works with a high degree of certainty to help most neuro-musculoskeletal conditions. That's why Canadian recommendations, such as those from the CCGI, the Canadian Chiropractic Guideline Initiative, emphasize a multimodal approach to care, meaning combining several different types of treatments to address a condition more effectively. However, what we do know is that certain factors are more likely to help. Considering the very personal and unique nature of your subjective pain, one of the most important factors is aligning treatment with the patient's therapeutic preferences. This means using techniques and tools that resonate with what the patient believes will help them, but most importantly, dedicating time to truly understand their condition. When a patient clearly understands the extent of their diagnosis, knows how long the recovery is expected to take, has self-management tools such as 1 or 2 exercises that make sense for them, and receives other personalized recommendations. And you combine all of this with a therapeutic approach that aligns with the patient's values, you have all the necessary subjective and contextual ingredients for achieving successful clinical outcomes and promoting patients' autonomy. But to better understand the information that will follow, I need to clarify important structures that can be affected by a stroke, which are generally located at the top of the neck.
When trauma happens to the neck, you can have what's called a cervical artery dissection. Blood clots form along the vessels of the neck where they can travel to the brain and eventually cause a stroke. 2
arteries running up each side of the vertebrae, which curve before reaching the brain to supply it with oxygenated blood. When a stroke results from a temporary or permanent lack of blood to the brain, it is called an ischemic stroke. If it results from the rupture of a blood vessel, it is called a hemorrhagic stroke. These concepts are usually what is highlighted in media reports.
4 arteries were ruptured. She suffered a stroke and cardiac arrest.
But to clarify things, do you know your chances of having a stroke at least once in your life? It's important to recognize that strokes are the 3rd leading cause of death in Canada.
Dad, the side of your face is drooping. Mom?
Affecting over 1 million people between 2003 and 2013.
It's probably nothing.
Statistically, your risk of experiencing a stroke increases with age.
Dad, are you okay?
You're slurring. Why are you slurring?
Rising to 10% for men and 20% for women over 85.
Raise your arms up in the air for me.
Certain factors, known as risk factors, can further increase your likelihood of having a stroke at least once in your lifetime.
Dad, are you okay?
In addition to high blood pressure,
Gracie, call 911.
lifestyle factors such as smoking, obesity, and an unhealthy diet play a significant role.
Honey? Oh, Dad.
While common stroke symptoms are widely known,
Tim! Tim!
strokes can also trigger worsening headaches and unusual neck pain, which is exactly where misplaced neck manipulations come into play. A 2016 systematic review representing the highest level of scientific evidence sorted and analyzed over 250 studies on the subject. And don't think this review was conducted by chiropractors or people with a vested interest in the profession. The authors were neurosurgery researchers from Penn State Hershey Medical Center with no affiliation to chiropractic. Their conclusions are very clear. They found only small associations referred to as correlations, and correlation does not equal causality. This distinction is extremely important. For instance, a study might show a correlation between people with 2 cars and a longer life expectancy compared to those with only 1 car. The second car isn't a magic pill that extends life. Rather, it may indicate a higher socioeconomic status, which could lead to healthier lifestyles. This differs from a causal link where one thing directly causes another to happen. The first event, cause, leads to the second event, effect. For example, if you touch a hot stove and burn your hand, the heat from the stove is the cause and the burn is the effect. That's a clear causal link. Let me give you one last example to clarify this point. If more ice cream is sold on hot days and more people drown in swimming pools on hot days, those 2 events are correlated because they both increase when it's hot. However, eating ice cream doesn't cause drowning. That would be a wrong assumption. It's dangerous to think that correlation is the same as causation because it can lead to incorrect conclusions. Just because 2 things happen together doesn't mean one caused the other. Always look for evidence of a direct cause before jumping to conclusions. The researchers also emphasized that there is no strong scientific evidence proving a direct causal link between strokes and neck manipulations. Additionally, they found that many studies have a high risk of bias and confusion, as stroke symptoms, such as neck pain and headaches, could lead patients to visit a chiropractor. Since back pain, neck pain, and headaches are the top reasons people seek chiropractic care, it makes sense that our profession may be more frequently associated with strokes. However, this reflects associations, not causation, because patients often come to us with symptoms that could overlap with early signs of a stroke. That's why, during the first visit, a chiropractor's primary goal is to rule out any serious health concerns before addressing neuro-musculoskeletal issues. This is done through a thorough review of the patient's health history, checking vital signs, and performing neurological and orthopedic exams. Unfortunately, problems can arise in certain chiropractic practices or with some therapists when they prioritize speed and profit over dedicating enough time to the patient's well-being. When such cases go to court, a common issue often surfaces. The healthcare professionals involved admit they failed to perform essential tests that could have narrowed the differential diagnosis and identified conditions beyond the neuro-musculoskeletal system, requiring an urgent referral to emergency services. In Canada, chiropractors, like medical doctors, psychologists, veterinarians, nurses, and dentists, are regulated by professional orders that ensure ethical practice standards for public safety. Failing to perform a proper assessment before treatment is a violation of these ethical obligations. A thorough clinical evaluation should reveal red flags, steering the differential diagnosis toward the possibility of a stroke and prompting an immediate call to emergency services. For instance, red flags could include extremely high blood pressure, such as 180/110, dizziness, nausea during neck range of motions, or even the absence of significant increases in perceived neck pain during orthopedic tests designed to provoke musculoskeletal issues, any of which may suggest a more serious underlying pathology. With all that in mind, how can a cautious chiropractor maximize preventive practices to minimize risks? One phrase that stuck with me during my doctorate at Palmer College of Chiropractic in the United States was, "Is this what a prudent chiropractor would do?" If the answer is no, then avoid that action. I mention this because it comes back to prevention fundamentals, maximizing benefits and minimizing risks. One preventive measure is to avoid manipulating a neck that has no discomfort or pain. More importantly, don't manipulate a neck with a full range of motion. If it moves well in all directions, there's no need to add more movement, which could push the physiological limits of the neck structures for no clinical reason. Lastly, avoid manipulating people with significant risk factors. Now, I think you can understand that everything we've discussed requires qualified healthcare professionals with high standards in education, evaluation, and diagnosis to ensure public safety in collaboration with a regulatory body. In Canada, when it comes to spinal manipulation, your go-to professionals are doctors of chiropractic, who undergo years of doctoral education to earn that title, or physical therapists who also meet equivalent university standards in training and have additional certification to perform these manipulations. Feel free to share your opinion, as I'm sure you have some, along with any comments or remaining questions, because an informed person is someone who is in control of their health.